You're listening to 3Ps in the West, Vision West ND's podcast on people, partnerships, and progress. I'm April, a representative of Vision West ND, an organization dedicated to strengthening communities, fostering economic sustainability, and building a prosperous quality of life across Western North Dakota. This is a space where listeners can hear directly from the people shaping our region, learn about the partnerships powering local projects, and see the progress that follows. On today's episode, we are highlighting the work of lay health ambassadors with Women Empowering Women. These ambassadors play a vital role in helping new Americans navigate healthcare and community systems, while also serving as trusted bridges of support and connection. Joining us are two remarkable ambassadors, Jana Jenkins, co-founder and executive director of Rural Diaspora Community. She connects with new Americans across Western North Dakota, encourages leadership, and shares her multicultural perspective in rural churches. And Alondra Lopez, who grew up in Dickinson, uses her own experiences as a first-generation American to help Spanish-speaking families across healthcare, resources, and support in time of need. Together, they embody the heart of this program: compassion, advocacy, and empowerment. Welcome, ladies. How are you today?
Good. How are you?
Good.
Thank you so much for having us.
Yes, it's exciting.
So let's just jump in. Can you tell me what a lay ambassador, health ambassador is, and how you help people in the community?
You want to start?
Okay. So I work with a Hispanic community. I'm Alondra. What I kind of do is I translate for I help them translate for their appointments, translate written paperwork. I also schedule their appointments, kind of help them fill out like Medicaid paperwork or like any services that the community offers, like if they need like information about the Human Food Pantry, about like Connect Medical or all those things. Yeah.
We have big suitcase or
Yeah, a briefcase, right?
briefcase that we lug around that has all sorts of community information that we share with our clients.
Yes.
So I work with the African community, and mainly both of us are helping these new Americans navigate the American healthcare system. American healthcare system is very unique and very different from other places in the world. Usually other places, when you're sick, you go to the hospital, and that's where you get treatment. But in America, when you are sick, you need to find a primary health care, a clinic. You know, they're not wanting somebody with a cold or somebody who's sick to go to the ER.
Yeah.
And so it's explaining to our clients how the American healthcare system works. And for me, a lot of my clients have, it's kind of a little bit different. A lot of my clients have jobs and they have insurance, but they don't understand how their insurance works. They might think they're like paying each month for this insurance. And so they think when they go to the doctor or when they have a procedure, it's going to be free. And so when they get the bill, they're shocked that not only am I paying every month for this, but then I have to pay. So then they stop going to see a doctor and they don't realize there are all these other things that are free with insurance, and these are the things that cost with insurance. So that's a lot of what I do is explain that. But we have other roles that we do as lay health ambassador besides meeting new American clients. There's several different programs that we do. One is Tummy Time and Postpartum Together, which is a program for young moms who are in the community, not only new Americans, but also moms from North Dakota or from other parts of the U.S. that have been living new to North Dakota and wanting to make friends and stuff. So we meet twice a month, and they bring their babies, and we do, like today we did.
Yeah, we actually had one this morning, and it went pretty good. We had a lot of people. We had a lot of new moms, and we actually had one mom that has twins, and it was really fun.
Yeah.
That sounds fun. That sounds a lot of fun.
And then we have another new program that we started called the Rose Program, which is for pregnant women who are in their second and third trimester. And it's a 4-week program, and it helps to prevent postpartum depression.
Something very needed here.
So is it just the two of you guys with lay health ambassadors, or is there other cultures that if let's say for the Hispanic and the African culture, is there other cultures that can reach out to lay health ambassadors?
Yes, so we actually have Yulia. She works with the Ukrainian and Russian, right, community. Um, and that's it. Hispanic,
Yeah.
African,
And
and
I
Ukrainian.
work also with islanders or other, yeah, we can work with anybody
Yeah.
who needs help.
Mhm.
And what other, so you guys do tummy time and stuff like that. What other like services do you offer? I saw something on your guys' website about like a tea party or something for women. Is there something like that?
Yes, for the women empowering
Empowering women.
women, they have several different things that they're involved in, which is exciting. And Lay Health Ambassador is just one of the many things that Women Empowering Women.
Okay,
Mhm.
perfect.
They have like a tech program for teenage girls.
Okay.
It's like a tech camp, kind of. And then they also have this program for the elderly women in our community. They just donate money to them for I think
Around Christmas
around
time.
Christmas time, yeah. So they can
Okay.
like
Yeah.
buy their
Perfect.
things.
So, moving to a new country or even a new community comes with many challenges. From your experience, what are the biggest barriers newcomers face when trying to access health care?
Language. Well, for my community is language. I was born in California, but we moved to Mexico for the first 4 years of my life, and then we moved back. But my first language was Spanish, and we moved back to Wofford City.
Okay.
So I was the brownest kid in my class. But it was really hard because nobody understood me. There wasn't any programs like for Spanish speaking kids, so it was really hard for me to communicate with like other kids and the teachers. But for healthcare, I would say, and my parents when they came to, they didn't speak any. Now they speak English, but they didn't speak anything. So any English. So it was kind of hard for us when we got sick. It was kind of hard for my mom, and then we didn't have insurance either. So it was very expensive, and it's kind of like in Mexico when you go to the doctor, there's free healthcare, and there's like healthcare, but it's not that expensive. It's like
And can't you
probably
just buy your drugs?
yeah. They give you the farm like they prescribe it to you if it's a really high dose, but if it's not, like they have certain medication like you can get metformin without a prescription there.
Okay.
And other kind of like drugs or medication. Um, but yeah, it's very different. And here it's very expensive when you go to the doctor. So and if you don't explain that to the person, they're gonna be confused.
And what's exciting is in our community, there's different places that help people who don't have insurance, like Connect Medical
Mm-hmm.
and other places, and but people just don't know about it, and so it's helpful for us to try to let people know about the different services that are available. To me, I think one of the biggest thing is just like I said earlier, just trying to navigate and trying to understand the healthcare system because it's so different. And knowing that I think our American system is more based on prevention, like doing tests, finding out tests early on before something gets full blown. And a lot of those tests, if you have insurance, are free, but people, don't know that that's available.
Mm-hmm. There's also a program called Women's Way.
Yeah.
We work with them too. We help people apply for that and spread the word about that program. It's so women can get free mammograms and pap smears, and which has helped my community out a lot because a lot of the people in my community don't have so their social security number.
Okay.
So it's kind of hard for them to get insurance, and those programs help them a lot because they don't ask for that. Um, sorry, but yeah, it helps them out, and they can get checked, and if they have like family members that have had breast cancer or cervical cancer, it like helps them detect it early on.
And they do like general women
Mhm.
well checks
Yeah.
as well.
So let's say somebody doesn't have a social security number.
Mhm.
Is that something you guys, so let's say they need to go to the doctor and it's something that they are requiring. Is that something you can help them inquire and like know the process? So if they come to you, you'd be able to help them with that process?
To go to the doctor or
to get a social security number? Like you would know the basics of how to do it, or
that's more like immigration attorney, but
you would know the right direction to point them.
Yes.
Okay.
Yes.
Perfect. All right. So why do we have lay health ambassadors here in Western North Dakota? And how have you personally seen this role make a difference for people?
I think you should answer this because your mom is so intricate, involved in this.
So, well, we moved here when I was 5. Right now I'm 23, so quite a few years ago. We've been here for over 17 years, I would say. And my mom actually started the first Spanish Catholic Mass. Here in St. Joe's. And from there she started getting more involved with the community. She started making, because she learned English and she was better at speaking it and translating it. So she would help the people that would come were new to the community. She would help them like figure out what church to go, or like help them sometimes get jobs or where to stay. And she would also help them with their like medical appointments. She would call to schedule their appointments, go with them to their appointments, take them to their appointments, because a lot of people don't have licenses, so they can't drive. And some of these people are older women that don't know how to drive, so it's easier to take them. And what was the question?
And she got to know Rayanne.
Oh, yes.
From that conversation, that's when Women Empowering Women started the idea of lay health ambassador with the input of the
everything.
Yeah, with the I was thinking the nurse. Health department. I can't think of what you call it in America.
So she did meet Rayanne, and she joined Women Empowering Women, and Rayanne started to see this big need in our community of translators and like helping people, guide people where to go and where they can ask for help. So she started to connect with my mom more, and then we started with this prevent diabetes class. I taught that class. Ryan reached out to me, and I was really honored to teach that class. It was a great class. And then we started with the lay health ambassadors. That was next. And we've been doing this for almost 3 years, right?
2.5.
2.5 years. Yeah, and just it's more to connect with the community and guide them where if they're new to the community, especially the Hispanics and Africans, and they come from different countries, different cultures, different customs, it's kind of hard to kind of get used to the life in the United States, and especially in rural areas like North Dakota, where it's predominantly white people, and there's no translators. There is now more, but it's rare to see like more Hispanics.
Yeah, that's another thing we did early on with lay health ambassadors is Women Empowering Women actually printed something that we could take to all the providers here in town to help them to understand about the diverse community that they're serving, and what the role that we can play in helping that. So that's something else that we did.
So personally, how have you seen this role help the community?
A lot. Especially in my community, they have they had my mom always. She would always help, but it was less known, I would say, and now it's more known. Like, I have my business cards and I give them, like, if you have family members that need help, tell them to reach out. And it's more, they have somebody to turn to that can guide them where they can go, and what they can do, and what's easier for them, and how it's cheaper for them to get health care, or how they can get their kids checked, or where their kids go to school and everything. So I feel like it's a little bit easier for the community because they have they know the source that can help them and guide them where they can go.
Perfect. Jana, do you have anything to add to that you've personally seen?
I was going to say a similar thing, that people like in the African community, if they have any kind of health questions, or they can call me and I can point them. They know I can point them to the right direction, or we can just go get coffee and enjoy good.
So if someone is new to the community and doesn't know where to start, how can they get in touch with a lay health ambassador?
We have a Facebook page that people can find on Facebook. Also, if you go to the Women Empowering Women website, you will see our page within that and way to contact us. And we just give out our phone numbers left and right.
Emails and everything, yeah.
Do you guys have flyers around town? So, like, let's say they don't have access to Facebook or anything like that, or they don't know somebody in that community already. Are there flyers out somewhere that if they were, like, let's say at the grocery store or the clinic or somewhere, Walmart, is there flyers out where they could see that?
We have in the past had flyers out.
I think we still have one in the social services office.
Okay.
And community action.
Okay. Perfect. All right. What does the first connection usually look like? When you guys get those people that come in, what does that first connection look like?
For me, when I first meet a client for the first time, I kind of go, try to spend some time getting to know them, because a lot of it is building up trust. If they've been referred from somebody else who knows me, they're more open. But if it's like a cold call or the first time, just talking to them, building up trust, and then explaining what I do as a lay health ambassador. And then we kind of go through their medical history. We have a form that has different things that we ask about, when's the last time you've gotten your eyes checked? When's the last time you've gone to the dentist? And, ask about, different things. And then do you have kids? Do you know about the kids program? Do you know about, so we kind of have a checklist that we can kind of go through and just kind of get a base. My main thing that I try to talk the very first time is ask, do you have a primary care doctor? And explain what a primary care doctor, and if they don't, I help them find a primary care doctor. So that's kind of my first goal for a meeting.
My meeting, they usually, it's a call. It starts with a call. They tell me that they need help with. They tell me, oh, my friend gave me your number that you can help me schedule an appointment. So I tell them, yes, what do you need? What kind of, what their needs are. If they need, a mammogram, I refer them to Women's Way. If they need WIC, I refer them to Nicole. She works at Southwest District Health Unit. She also works with the Hispanic community, and she works with WIC. If they need Medicaid, I help them fill out paper. They just tell me what they need, and I'll schedule an appointment and then go and take the papers, help them fill it out, and yeah.
So, Alondra, this is a question for you. You had said something about that it's a phone call. At what point do you get to meet them? And is it at their appointment, or do you try to meet them before their appointment? So there's a little bit of...
It's mostly at their appointment.
Okay.
Yeah, I meet them at their appointments. And then I get to know them there. I ask, oh, where you from? Why'd you come here? And it's mostly because there's work, or it's always the same. Okay. My husband brought me here.
Like me.
Yeah.
Those husbands. All right. Can you share a story of someone who you've worked with who was struggling at first, but was able to feel more secure and connected because of this program?
I think we can more talk in general.
No, that's fine.
Because especially we try to keep our client, I mean, it's their story and it's their story to tell. But I think in general terms, do you have a general story you would like to share?
Well, I think last year, a big population of the Venezuelan community came to North Dakota, and I helped a lot of them. I was working every day, and I would meet groups of people to help them fill out Medicaid paperwork, and I feel like I kind of helped them okay, this is what this means, this is what that means, and I felt that gave them a little push to go forward and try it themselves, because you have somebody that can help you, but that person's not always going to be there, and you have to also learn. And yeah, I felt like that community benefited a lot from that, and it helped them get closer to the community and to this community in North Dakota, and the Hispanic community, and find jobs and kind of get a sense of purpose.
Okay.
Because when they come from all the way from Venezuela or from Mexico, it's a long journey, and it's hard and it's emotionally challenging, but with that little help of that person, I feel like it makes them feel um with hope. Like I feel like they have more hope and go
And they can
forward.
take that next step and
Take
then
that
that
next
next
step.
step. I think kind of a general story with more the African community, what I love seeing is how they can, when there's a new family that comes in, how the African community can come around and help them, especially those that have been here longer. And even um, my work as a lay health ambassador, I can see how certain clients that I saw more regularly and tried to help them, saw them take that information and share that with others in their community and help them. And that always makes you feel good when you're not the only point person, but they're sharing the information about Women's Way to somebody else. I'm like, oh wow, that's great.
Yes.
It's got to feel good to know that you were able to help somebody and now they're helping somebody else.
Yes.
Like, and that's because of something you did, and it's got to feel really good to have that.
Yeah, it is. It's nice.
All right. In your opinion, how do you see this program improving over the next 5 years?
I feel like we're gonna have more lay health ambassadors, hopefully, and the state gives us more funds. But yes, it's a very big need in our community. It's in hospitals and we're in dentists and anything you do, you need a translator.
Explain, like, you know, in the hospital, for those of you who might not know, there is official translation that's done with a pad, but iPad. But kind of explain in general, like when you have gone to the hospital when somebody is delivering a baby, and they don't know English, and
so I've helped quite a few women deliver. Most of these women are here alone. They don't have families, and they don't speak any English. And when they go to their doctor's appointments, they just get, an iPad like here. But sometimes these people that are translating are Cuban or Puerto Rican, and they have different and Spanish is in Latin America everybody speaks Spanish, but each Spanish is different.
Okay.
I'm Mexican. I understand pretty well Mexican Spanish, but if Puerto Rican Spanish is kind of hard for me to understand because they speak really fast and with an accent, and I'm pretty sure they think that I speak with an accent too. But yeah, so I've taken like 3 or 4 patients to help deliver, and I mean, imagine you're in the middle of a contraction and they just, here's an iPad, what do you need?
so impersonal.
Yeah.
Whereas her being there can really,
like, and I would advocate for like these women, she's not feeling good, like she wants this, and because how are you gonna tell somebody like, oh, and it's not the same, or like when they're pushing, how do you explain to them how to push if they can't understand you in their middle of labor?
That's got to be scary for them if they're trying to talk to an iPad. The iPad's talking to the doctor,
and you're screaming.
The doctor's talking to the iPad. Like, that's got to feel very.
Nothing, but being there in person is so much better.
Yeah,
that's why we need more
lay health ambassadors.
What would true access and belonging look like for newcomers and their families?
I think all of us, no matter, if we were going to a foreign country, you don't want to be a foreigner the whole time.
Yeah.
You want to grow to be a part of the community. You want to understand things. You're in a learning period for many years, but eventually you want to cross over to feel like you are a part of that community. And I think that's one of the roles we do as lay health ambassadors, is help people feel like they're valued and they're a part of this community and they're important.
And I feel for my community it's kind of a little bit harder because they don't speak the language, and their cultures, well, I mean, the African community, their culture is very different. So and I've experienced this because I have a lot of family that come from Mexico, and my husband's from Mexico, and he had a really hard time kind of changing his mindset, because I would tell him, no, we're not in Mexico. We're like, this is not the same as if you were in Mexico. You're in the United States. Like, this is different. And that's what I try to explain to my clients when I see them, because I know they have a hard time with that. Like, oh, it's because in Venezuela. Oh, it's because in Mexico. Oh, it's because in Cuba. But we're not there anymore. You're here, and we have to follow these rules, and you have to like, because the lifestyle here is very different from, you're working constantly. You don't have, it's like a very, wake up early in the morning and you get back really late at night from your job. So it's kind of like physically and mentally, how do you say that?
This is really challenging.
Challenging, yeah.
Different cultures. There's some culture clashes, but I think every culture can bring the good. Instead, I think North Dakota can learn from the Hispanic culture. They can learn from the African culture.
Mm-hmm.
Africans and Hispanics can learn from each other, and then they can also learn from North Dakota. We can all learn from each other.
And just all get together.
Wouldn't that be fun? An event where everybody just comes together and we all learn about each other's cultures and like get comfortable.
A few weeks ago, we had the taste of culture where you did the Spanish dancing and we had African dancing. And
there's the festival. I think they do it every year.
Festival.
Okay.
Yeah,
there's ethnic festival.
Ethnic festival. That's what it was.
And that's up at the
museum.
Okay. Okay, I didn't realize like that's what that was.
Yeah.
Like, and it's more multiple cultures up there.
Yeah.
It's changed over the years. This was the first year the Rwandan community was present.
It was beautiful.
And it was really nice. They did Rwandan dancing, and they also had a booth.
And we had food. My group, it's called Sote Mexico. We're a Mexican folk dance group. And we've been dancing there for almost like 8 years.
Yeah.
Oh, wow.
Been there longer.
That's awesome.
But it's the first time in the African community. And I almost cried because I was like, oh my gosh, yes, there's more people. And I know how it feels to like express your culture to other people, and it's very nice.
I think people seem to really enjoy it.
Yeah, it was really nice.
That's awesome. What is one simple step our listeners could take this month to support lay health ambassadors and our new families in our community?
I would encourage you to go onto the website of Women Empowering Women and support what we're doing. We always need funding, and they're doing many different great things, and one of the great things is the Lay Health Ambassador.
And it's not only for like new Americans, it's for anybody. This tummy time, it's for anybody. There's Hispanic, African, anybody can join. And we're also gonna do behavioral, no, not that, what's it called, Better Choices, Better Health. Yeah, so that is we're gonna teach that class, both of us.
Can you tell me again what that is?
Yes.
Better Choices, Better Health. It's gonna be held at Sanford. It's for people that have chronic illnesses.
Okay.
We're gonna start with an English class, but gradually we want to do like a Spanish class or Ukrainian class. But it's for people that have chronic illnesses to help them change their lifestyle or learn how to live with that chronic illness that they have.
I just say check out the website, see if there's things. Refer people. If you see and meet a new American, you can ask them, hey, have you met with a Lay Health Ambassador? If not,
here's their card.
Perfect. So a question I have for you is, let's say a new American or somebody new to the area moves into somebody's neighborhood. How could somebody in that neighborhood making that person feel welcome, like just out in public like that? How can the community help those new Americans feel welcome if they hadn't gone to a lay ambassador?
I think anybody wants people to listen to their stories. And I think being genuine and showing up and saying, hey, I see that you're new to our neighborhood and I just wanted to come and welcome you. I have some cookies, or just like how North Dakotans, do, and then say, I want to hear your story.
Like, where'd you come?
Yeah.
Where'd you come from?
And also maybe give some tangible help. Do you know the different grocery stores we have around here? I've printed this out for you. You can find, because that's the hard thing when you move to a new community. Where do I go to get milk? Where do I go? There's like, oh, I see you're from Africa. Do you know that we have an African store here in Dickinson? This is where it is.
Mhm.
Things like that.
So a lot of it's just kind of making that connection to make them feel welcome.
Yes.
That's awesome.
I think for the Hispanic community, it's a little harder because they don't speak English. Well, a lot of people do, a lot of the Hispanic community does, but the new ones they're not really used to it. But I mean, you can do it with an iPad or your phone, like Google Translate, like, hi, my name is this, and thank you. Like, I'm glad to see you that you're living here, and we need more color.
Yes, we do need more color
in our neighborhood.
Yes.
All right, ladies. So I need you to finish this line for me, okay?
Okay.
Western North Dakota thrives when?
Western North
Dakota thrives when
it's full of diversity, and when we can learn from each other and
appreciate each other.
Appreciate each other, just like our great grandparents who came from all over to North Dakota. Now there's a new wave of immigrants coming, and we just need to welcome them.
Mm-hmm. Yes.
I like that. I like that a lot. Well, I want to thank you both, Jana and Alondra, for coming on today and being on the show. And if any of our listeners have any questions or need anything, please go to www.wewnetwork.org for more information and resources. Anything else you guys need to add to any of this?
No, I think that's it. Yes, thank you for having us. This is an honor.
Thank you, guys.